Хорошо, ладно.
Next theme is Mediastinum. Mediastinum is a term which means the complex of organs occupying the space between the mediastinal pleura, that is, between the right and left pleural sacs. And this complex is called the mediastinum. This is left lung, this is right lung. Each lung is covered by the pleura. Pleura is a serous sheet, one of 4 serous sheet in men and from 3 serous sheet in female. So there are peritoneum, which we already know. There are pleura. There are pericardium in female, and in male there is also serous sheet of the testis. So all these structures are the same according to the intrauterine development. It's very thin and usually it's transparent. So here we can see the lung which is covered by the pleura because pleura is transparent. Peritoneum also is transparent, but very often in peritoneum there are a lot of visceral fat, but in pleura usually there are no visceral fat, excluding very serious overweighting subjects. And this is another picture. What is different? They use these instruments for open the space between lungs. And all these organs inside of this space, they are organs of mediastinum. So mediastinum is complex of organs occupying the space between the mediastinal pleura or between the pleural sacs. What does it mean, pleural sacs? Each lung is placed inside of practically closed, hermetically closed sac. The walls of which is from parietal pleura. That's why left lung and right lung are completely isolated from each other. And this parietal pleura is demonstrated here as brown part of the cirrus sheet. Here it is. This is mediastinal pleura. And in right picture, it was opened to opposite sides. The most serious difficulty of this theme for us is the necessity to keep in memory each organ which belongs to different part of the mediastinum. Now we don't know each of these vessels, of the nerves, which belongs to, for example, superior and inferior mediastinum, but we ought to call it when we answer the question, what is mediastinum? So this is one of difficulties. And very useful for understanding to look at the radiogram of the lungs and of the chest as well. Usually on the film we use negative imaging of the radiogram, and here it is positive imaging. So all these dark structures are shadows, and all these light or white zones are the zones where the air is placed because of this is the lungs. So right lung, left lung, and this dark complex of structures, this is mediastinum. Sure, in radiogram it's impossible to distinguish one structure from another in this complex, but another contemporary methods of medical visualization is very useful according to this purpose, and using computed tomography and magnetic resonance tomography, MRI, we can distinguish each of the organ. But in radiogram we also should know each structure. I shall not call each of them, but you should know, you can make a pause in the record and you shall watch this video, and to distinguish each detail, because this picture we shall use in our tests. And now, next question which is necessary to understand the borders of mediastinum. You can see that this is horizontal section of the body at the level of the chest, and in such kind section we understand that all these are organs of mediastinum, but now we should find the boundaries of the mediastinum from each side, and this is from lateral sides, border which is formed by the mediastinal pleura. So this red line is mediastinal pleura. Again, visceral pleura so close contact the lung that it's impossible to remove pleura without damaging the lung. So visceral pleura is fusioned with the lung. But parietal pleura, it surrounds the lung from all sides, and from medial side, this red line, it called mediastinal pleura. So mediastinum is the complex of organ between mediastinal pleura from right side and left side. Then another boundary is the bodies of thoracic vertebrae. It's clear. And now number 3 is sternum. And what about superior boundary? It is apertura thoracis superior. Superior boundary is apertura thoracis superior. I can use now this sagittal section. No, not sagittal, parasagittal, because here it is incisure castalis of sternum, so the section was made parasagittally. And number 4 demonstrates us the apertura thoracis superior, which is artificial border of the mediastinum. So superior to apertura thoracis superior, it will be organs of the neck, but inferior this plane we can find the organs of mediastinum. It's easy to understand that mediastinum contacts to the neck, and organs of the neck prolongates into the mediastinum. And the last border is diaphragm. So diaphragm number 5, it is the boundaries from inferior view of the mediastinum. Now we can understand in detail what is mediastinum, and next question is division of the mediastinum into departments. You can see that in this picture mediastinum is colorized into 3 colors. So this violet color belongs to mediastinum superior, the upper mediastinum, or mediastinum superior. And we can use this red dotted line to demonstrate the border of superior mediastinum and the lower on inferior mediastinum. And inferior mediastinum, lower mediastinum also can be divided into 3 parts. Now we can explain how this dotted red line pass. We can say that the border is the plane from the point of connection of the sternum, here it is, to its body, front, to the intervertebral cartilage between fourth and fifth vertebra. So this is the artificial border inside of the chest. Why artificial? Because really there is no any septum, connective tissue septum, or bones, or another real anatomical borders. But we only can imagine ourselves this plane or make it in the some pictures of medical visualization, such kind of plane really. And now about the lower mediastinum. So it consists of three parts: anterior mediastinum, medial mediastinum, and posterior mediastinum. In this scheme, these three parts, anterior, medial, and posterior, are the same width, and really they are not equal to each other. So anterior mediastinum is quite small space, quite narrow space behind the sternum. And medial mediastinum, which contains the heart, is most large from these three parts, and posterior mediastinum again is quite narrow. So now we should try to write down a table, a special table, where we can distinguish each organ of the chest and to say if it belongs to superior mediastinum, to inferior mediastinum, or any departments of inferior mediastinum. So I propose you to write down such kind of table. Please use new page in your notebooks. So we use here the division into mediastinum superiors and mediastinum inferiors. According to mediastinum superior, first organ which we ought to know is thymus. Thymus is a very important organ of immune system, which is very good developed in small child, usually before 3 years of old, and then it becomes fat tissue. It could be demonstrated in our cadaveric specimen, but as a fat tissue organ. Practically, in adult, the lymphoid tissue absent in thymus. Then, arcus aortae. The aim of our practical exercises during our practical lessons is to find each of these organs, to demonstrate it on the cadaveric specimen and on the models, anatomical models. So arcus aortae, and from this most important and large arterial vessel originates three another vessels: truncus brachiocephalicus, arteria which nourish the right arm, right part of neck, and the head, truncus brachiocephalicus. Then arteria carotis communis sinistra and arteria subclavia sinistra. In Russian it's written that proximal part of it, only proximal part of it. Arteria carotis communis sinistra and arteria subclavia sinistra. They nourish with oxygen left part of head and neck and left arm. Then vena cava superior. Vena cava superior is the most important vein which drain also the upper part of our body. Into vena cava superior inflow the brachiocephalic veins, vena brachiocephalica dextra and sinistra, and also the next important organ of superior mediastinum is trachea, esophagus, and nervus phrenicus. Nervus phrenicus. It would be better say that not nervus phrenicus, but nervi phrenici, because it's paired nerve. We can find it in the right and left sides. Also, nervus vagus or nervi vagi, because it also paired nerve, and from vagus originates nervus laryngeus recurrens, also very important nerve which provides the possibility to pronunciation. That means the movements of the muscles of the larynx. Now, mediastinum inferius. We know that mediastinum inferius is subdivided into three departments, and we begin from mediastinum anterius. In mediastinum anterius we can find arteria et vena thoracicae interne. Very interesting vessels. They could be found posteriorly to the sternum, and in previous anatomical terminology it was called as arteria and vena mammaria interna. Arteria et vena mammaria interna. This term means that these vessels are very important in nourishing of mamma, the breast, for process of milk production when the woman nourish the baby. And also in mediastinum anterius, we should remember lymphonodi mediastinalis anterioris and parasternalis. Parasternalis and mediastinalis anterioris. You know, in our organism there are at least 250 cubic centimeters of lymph nodes. They are spread during all our organism, and usually we don't remember about these small but very important organs. But in situation of any injury of surface of the body, they become inflamed, painful. We can palpate it very often in inguinal zone, very often in axillar zone, and so on. So very important lymph nodes, mediastinal, anterior and parasternal lymph nodes, they are important for the control of this internal environment of the breast. Then mediastinum medius. What can we find in mediastinum medius? The most large organ is heart, core. Heart, core in Latin. And vessels which originates from the heart or oppositely enters to the heart. For example, vena cava superior, here it is, aorta ascendens, then truncus pulmonalis, which later divides into two arteries, exactly, arteria pulmonalis dextra and arteria pulmonalis sinistra. Then venae pulmonalis and trachea and bronchi principalis. Trachea and bronchi principalis. Also nervus phrenicus. Now we practically finished the list of organs of mediastinum medius. Another question. Next subdivision is mediastinum posterius. But where is the border between them, between mediastinum medius and mediastinum posterius? In simple words, we can say that this border passes through posterior surface of the radix pulmonis. So, now I write down that boundary is the posterior margin of the pulmonary root. Radix pulmonis is pulmonary root in English, exactly trachea and bronchi. So, if nervus phrenicus is located anteriorly to the trachea and bronchi, so it belongs to mediastinum medius. And if nervus vagus is located posteriorly to the trachea and bronchi, it belongs to the mediastinum posterius. So now what we can find as organs of mediastinum posterius. First of all, esophagus. Esophagus passes through mediastinum posterius. Close to it, aorta descendens, also in mediastinum posterius. Then vena cava inferior, also in mediastinum posterius, and ductus thoracicus, also in mediastinum posterior. Ductus thoracicus is most large lymphatic duct which gather the lymph from the lower extremities and the abdomen and transport it on the neck. And then we can find ductus thoracicus on the neck when it will enters to venous system, where vena jugularis interna sinistra connects with vena subclavia, so named venous angle. Then nervus vagus, again, nervus vagus is part of the mediastinum posterius. And vena azygos, very interesting vein. I shall demonstrate it in our cadaveric specimen, and so named nervi splanchnici. Nervi splanchnici. So this table is very important for keep it in mind. So be ready to find question according the positioning of each of this organ in different parts of mediastinum, both in oral exam and in tests. So thank you for attention. You are free.